ICD-10 is one of the most complex initiatives that the industry has undertaken in the past 20 years. The complexity of this integrated activity throughout each payer, vendor, provider, clearinghouse, and other trading partners is going to be the most stressful, as well as the greatest advances in the capture of data regarding our patients, and also the care of those patients ultimately by the compilation of that information, and also in utilizing that for best practices for patient care. Change is going to occur in each industry differently. Every industry participant needs to identify their own processes that are related to ICD-10 initiatives. From a provider's perspective, the initial element that you have to undertake is a complete analysis of your existing technology, identifying where each software integrates with ICD-9 codes currently, and then contact your vendors to determine what software updates you're going to have to implement for the compliance with ICD-10. Once you obtain those software updates, then you must test those software updates after each software piece is implemented. In that fashion, you will mitigate, ultimately, potential errors within your own system that may occur due to those software updates before you engage your trading partners in testing for ICD-10 compliance. Additional elements that individuals should be aware for ICD-10 is that currently the complexity of the integration process internally in physician practices as well as hospital organizations has determined that sometimes there's a lack of personnel, knowledgeable personnel, as well as enough personnel to devote to this initiative. One of my suggestions would be to analyze your current staff and also your education and training of those staff members to determine if they can handle the complexity of this integration process. Then you can determine if you need to outsource some of the elements of the implementation for ICD-10. That's most significant because you don't want to have your practice or your organization limited by the limited knowledge of existing personnel. You need industry experts to guide you and also provide resources for you for your compliance.